Hello, welcome. We'll get the session started go along with it, So I just want to express my gratitude for your presence here tonight, especially during the cold and rainy weather outside. Thank you for coming out. We are excited to have you all here for our 150th meeting at the Kamwo Center. So allow me to introduce myself briefly. My name is Clayton. I am the Community Engagement Manager as well as the co-organizer of this event. I'd like to extend a warm welcome to our members, either you're here in person or via online live. Tonight, we aim to provide you with an enjoyable and informative experience, and we have plans to host more in-person events like this about once a month too. So keep your eyes out and open. So tonight, the core mission of our meetup group is to connect our members with esteemed authorities in our profession. We are deeply committed to using events like this to foster connections and build a stronger sense of community within our field. In case you missed it, we transitioned from meetup.com to Facebook platform last December. So there's a private Facebook group, Kamwo Meetups, that you can join over there to give us so that you know the latest up-to-date events that we're going to have in the future. And don't worry, I'll also drop it in the chat too for those who are in live session. As a special thank you for attending tonight's event, some of you will receive an email containing a $20 coupon for use of Kamwo's Research online store. Along with the coupon, a link to the recording of today's lecture will be made available to you as well. You should expect the email coming early next week. If you don't see the email, please check your spam folder or email payang@kamwo.com. I'll also put that on the chat too, so you guys have it. And yeah, if you don't see it, then we'll figure it out then. The talk tonight is expected to last approximately 1.5 hours. This will include a short lecture and a couple of small demos. Following that, there will be a short Q&A session, and we expect it to be around 8 o'clock Eastern Standard Time. Before we begin, I'd like to share a few ground rules. For those that are attending live via simulcast, I ask that you mute your microphones to minimize background noise, and hold off on questions until our guest speaker prompts the Q&A session. If you have an urgent and relative comment, please type it in the chat box. As your host, I will note the questions and make sure that Dr. Shiu gets to see them towards the end. This is to ensure that the lecture remains uninterrupted. Same goes for those here in person, so we'll try to hold off on the questions until so before I hand it over to our esteemed expert, I'd like to share with you a introduction about Dr. Clayton. He is one of the foremost experts in treating stroke and neurological conditions in the field of CCM and acupuncture for over 19 years. After getting his license in acupuncture from the Pacific College of Health and Sciences, he also pursued a PhD degree in acupuncture and osteopathy in Cambridge University of Medicine. During his time, and then he also studied in tutelage of Dr. Shiu at First Teaching Hospital, exploring deeper into acupuncture treatment for cerebral disorders. Currently, Dr. Shiu is dedicated to updating his educational teaching program, Acupuncture Seminar. He is also passionately working towards standardizing effective acupuncture treatments for post-stroke and other neurological disorders like Alzheimer's and Parkinson's. What's particularly remarkable about Dr. Shiu's work is his mission to cultivate a nationwide army of stroke literate acupuncturists. So without further ado, let me turn it over to Dr. Clayton.
Welcome, everyone. That was a very nice introduction there. This is actually the first time I'm teaching live in New York City in a long time. It's been quite a break from during the pandemic and everything. So, and what we're gonna do tonight is like it's more of like trying to update the landscape, what's going on with stroke and neurological disorders. A lot of it's important to what we've been seeing at our office and treating in New York City. And we have a special neuro clinic where we get patients from all over the world. Sometimes they check in for a week and they might get treated 10 times or something like that, and they might fly back to whichever state you go to, or come back like in a month or two. So we do see some interesting cases, and we've seen a lot of different exposure and stuff. So, but today, what I want to do is get into everything that really has happened since the pandemic, especially since like 2019 and everything. So, and why I want to do this lecture, why it's so important to me, is because I first started giving these lectures after I returned from China in around 2017. And I'm a graduate of PCOM, or Peaches, right? That's what they call it now. So Pacific College of Health Sciences. I like that acronym. So, and my mission from studying with Dr. Shiu in Tianjin was to see if I could take what I was learning and bring it into a small clinical practice, so that as we're treating, like in China, they were treating like 10,000 patients a day. It was almost like the whole Mount Sinai system, or Columbia Presbyterian. The whole thing was a stroke neurological clinic. It was like one big epicenter of clinics and stuff. So, but China is like that, because in China, if you wanted to specialize in the stomach, you go to the city that does that one disease. Okay, so if you want to do stroke, and you want to do neurological stroke conditions, you go to Tianjin. All right. And the funny thing is, even if you're limping or dragging your foot, even the person selling dumplings on the street would tell you which building to go to, because they know the city, because the city is defined by this acupuncture system, which is Shinao Kaicha, which is awaken the spirit, open the orifices. And so my time spending 4 years there was to observe it, really track different conditions, seeing people get treated 10 times, 20 times, 30 times, 40 times, 50 times, and seeing whether or not, like, because I'm a pretty positive person, but whether or not you should continue treatment, or should you just now defer to another method, okay? Because sometimes you might be on the right track, but then you just had to do 10 more sessions, but how do you know, right? Especially if you're simply putting in stomach 36 or LI4, like, how do you know? It's really hard to tell. So the benefit of my time there was I could see arcs of when subtly someone, who couldn't chew their food or had a gastric tube down their throat could actually swallow food, and we would count it like 49, 50, 55, and then they would take the tube out. This person recovered, and we never saw that, or at least I never saw that when I was living in America and working in different systems. So that experience and seeing the large amount of patients of different types and tracking it was like a huge benefit in my overall idea of what acupuncture could do. Okay, so when I came back in 2017, went to China, I left a very small practice. I was treating like different Major League Baseball players, different like well-to-do people, even celebrities and all that stuff. But I actually knew that I was terrible at treating stroke and like that condition. And so surprisingly to the community, I just packed everything up and I was like, I'm gonna live in China and live off of this like $3,000 a year scholarship and just like whittle everything down to like the basics. So definitely the ramen days started there. So when I came back, I did start the nanopuncture seminar series. So each module I would take something specific, like gait training or speech paralysis or the gut brain. And we would teach it for a weekend and try to teach like with techniques, how you should see the body from a Western perspective, how you should see it from an Eastern perspective. And then the main thing was helping students and practitioners and doctors and therapists know how to practice their needle, because it's like building a skill. It's like playing music and stuff. Okay. So so we started doing that. We started getting a lot of momentum. We were treating a lot of people. We were training people in Chicago, Austin, Oregon, Florida. And that was, I was trying to spread widely around the country until we had this network of people, right? Because after learning this, you just realize you can't treat everyone, you know, so you have to figure out a method. And you have to teach people a way to think so that they can figure out and create their own GPS how to treat, okay? So one person can't treat everyone, you know? And taught, I mean, of course, my teacher, Dr. Shiu, and many other amazing teachers they're like just super gurus, you know. It would be like if Michael Jackson walked into this block and like lights would shut down and people would gather, you know. But even Dr. Shiu knew that like you can't treat everyone, you know, so he figured out a methodology to teach people how to reproduce results, you know. So
Sorry, I didn't mean to interrupt. Actually, I was wondering if we can have your computer be joined to the Zoom meeting so that you can share the screen so that the people live can see your PowerPoint slide. Is that okay?
Yeah.
Yeah. Sorry, just
so,
let me send you a link.
Okay.
So, sorry about that. Give me one moment.
sorry.
Yeah, just escape out of it for 1 second. I'm worried link for right now.
Just gonna send you guys
I need help
crazy.
doing.
Like, yeah, I was one there.
Yeah, sorry about that. It's our first time doing live chat with.
Oh man, I'm the.
Yeah, you're first.
I'm thinking that. Probably. What's your? Yeah, what's your Wi-Fi?
Oh, great.
Because otherwise I can't.
Around. Mhm.
So I'm gonna open it and I'm gonna share screen.
Yes.
Okay.
Oh yeah, and then so yeah, once you join in, I'll make you the co-host, and then you can share your screen. Yeah.
I know a little bit. You should play music and serve tea to the guys.
I know. We don't usually play music here. There's something we have.
All right, I almost got it. Sign in. Don't sign in. Is there a password to web meeting?
No, there's no password. It should you just click the link. It should spin up.
It says don't sign in here or something.
One second. 399690430. Yeah, 839-179-64. It's not doing it. Give me one moment. Sorry, just give me 1 second. I'm so sorry, guys.
It's okay. I'm gonna do right? Where do I do it?
Oh, no, you do your email. Like whatever yours. It's just. Okay, I'm gonna give you a meeting ID. You join the meeting and then I'll give you
Okay. Oh. Yeah.
Oh.
I'm sick. Oh, wait, don't go anywhere. I think I'm in my account though.
Yeah, no, it's good. I see you. I just have to admit you in. Yes. And then let me.
Do you want me to join with my computer audio?
Oh, no, you don't have to join with your computer audio. Then I just made you a co-host. So you should be able to share your screen.
Recording in progress.
Wow. Okay. So
And we'll be.
yeah. Okay, so where's usually it's on the bottom. Where's the screen?
A share screen.
That's it. Okay. Here we are. Okay.
Ray, is it popping up here? Would you be able to connect to the HDMI?
Yeah, I'm gonna. I'll do it.
Okay.
In 1 sec.
Okay, but. Now this.
Okay. I have to stop sharing because I'm on the wrong screen. so
Oh, okay, no
hold on
problem.
1 second. All right. Let me close some of these so I can find where we were. Oh, here it is. Okay.
Okay. So my volume's off.
Yes.
Yep. Fix number 3. How do I shrink the? Yep. Okay. This might be easier to start. Okay. Can they hear me?
Yes, they can.
They can hear me now.
Yes.
Hey guys, we're back. This is great. I see a couple of classmates actually. Okay. The owner of Kamwo is actually one of my classmates, Thomas Long. So it's great to reconnect with everyone here.
That's awesome.
And others. So yeah. Okay, so we're back to the mission. Okay. So this is a lot to try to cram in an hour and a half. So we're really painting brush strokes today, but we're gonna have more chances to do some serious practicing of techniques another time. But today we're talking about the mission, why we're talking about stroke, why I want to talk about it so early in the year. So when they called me to do the first meetup, I thought it was great. And when COVID happened, after teaching for 3 years and going around the country, as well as a lot of people, we almost lost our businesses. We had to close our offices, especially during the pandemic. And so to survive, you have to be able to pivot, right? But it was really depressing. Right, neural clinic I was telling you about, we had to like lay off everyone. We just opened it, we had to fire everyone so people could survive. But close the office, acupuncture schools were closing down, the laundromats were closing down, the delis, everyone was closing down, and we're still recovering as a city. But even though we were closing down and everything, stroke did not close down at all. And that's why we're having this talk here, okay? Because even we took a, and I got in shape right now, so, but I wasn't shape as much pain, and the team, stroke became even a bigger epidemic in the 3 to 4 years, all trying to recover from the pandemic. And so we're going to talk about those things today and introduce how to spot, how to understand and recognize, analyze when you're treating someone, whether or not they're being affected today by with their issue by COVID-19, or possibly too much vaccination, or possibly this is COVID long hauler syndrome. So that was the main goal of this talk, was to try to teach you guys how to differentiate it and teach you the methods that we literally started to create in the last couple of years in my clinic that helped get us better results. And also to expose you to new techniques, new technologies, new ways that we analyze stroke, and also COVID-19, and also just being exposed to these pernicious kind of viruses and stuff. So, okay, so it took a lot for me to come back and start talking again. Actually, I'm trying really hard, trying to be positive. I want to do a good job, but like it was a lot because I got depressed too, and I had to get motivated too, So all these resources that I'm talking about, I started using it too. I'm like needling myself, putting helmets on, like doing all this different stuff. Okay. So what was scary was when I started to return was just reading the news and seeing more and more of these interesting, strange cases that started to come into our offices, or even at the school clinics for some of our students here. Okay. So what I want to do is really talk about making sure that each one of us, as acupuncturists, as herbalists, or as TCM doctors, or just even as any kind of healer or therapist, we have to become more stroke aware. And just like with Lyme disease, they always talk about you have to be Lyme literate, right? We have to be stroke literate too. We have to be able to recognize if we're actually just dealing with stroke, or someone who had a stroke, or even at times you could be dealing with someone who had a stroke but has Parkinson's too. Now, how are you going to separate that and get results? Okay, so there's a method for all this too. Okay, so, but I truly believe that our profession is really the front line that should be involved with people who are having the kind of cases that we're going to talk about today. And I believe that we are such an effective, amazing profession. It's a profession that I grew with, that has, that I cried with, that kicked my ass when I was studying and stuff, but also that picked me up, was the wind beneath my wings and all that crazy stuff. Okay. And because of that, that's why I'm here. That's in it. And the profession and teaching allowed me to meet just amazing doctors and other patients and other healers too. So if you're just graduating and you should be excited because you're in an amazing profession that has, I can say that our profession has evolved in such a way that other professions, I feel, in many instances has been plateauing, and they look to our profession for ideas actually. But even things like, for instance, for stroke in 2018, they just changed the diagnosis code, ICD-11 code, for stroke to consider it to be neurological, when for about 30, 40 years, it's been considered circulatory, okay? The fact that it got switched to neurological means there's gonna be more grants, more research, more funding for stroke and opportunities. If you have an idea, okay, because we have really crazy ideas in my clinic and stuff, but if you have an idea, you can get funding for it, and you can research and stuff. So in our clinic, we were getting such great results that we would buy stuff to prove that we didn't get the result. Like we would get like a QEEG helmet and like try to scan a live QEEG to see whether or not we were actually affecting the circulation of the brain. It turns out we were. And it took us such a long time to learn it that became part of our office. We would meet people and see that they need a brain scan, and we actually do it in-house. So in my office, we actually perform the QEEG, and we even share it with other doctors. We've shared it with students that have ADHD, and then they weren't getting the help they needed from their counselor. They would take the acupuncturist QEEG report and get their diagnosis switch and get extra time, at school. So wherever we are at in our profession, we're at a place where we're heavily regarded as full doctors. We have a say, we have gravitas, and we didn't have that like 20 years ago. It wasn't even the same 10 years ago, but I don't know anyone who doesn't know their acupuncturist that you should try, because I have a guy that you should try, and so everyone has tried acupuncture, but acupuncture can go so far. And so this is meant to be a little inspirational, but really like it can really save lives and stuff. Okay. So stroke is our mission today. And you guys can't be the front line. You just have to be able that are the front line already. Okay. The second you finish your boards and stuff. Okay. So what is a stroke? Originally, a stroke is any time there's a lack of blood flow carrying oxygen to any part of the central nervous system. The central nervous system being the brain and the spinal cord together, okay? But the stroke can be something as large as an artery connecting the two hemispheres, and you have a huge intracerebral hemorrhagic stroke. Or it can be as brief as just a few cells that didn't get oxygen, that didn't have the blood. Those could be transient ischemic attack strokes, okay? Stroke can be as small as large as the sun, just kind of shape.
Okay, so what you have to do is you want to train yourself to start recognizing when someone might have had a stroke or had a stroke and what degree or where they are in that timeline. And then you can devise a path for their recovery. Okay. Sometimes you hear the words cerebrovascular, and stroke is always abrupt, it's always sudden. Cerebrovascular diseases are diseases that take time, that eventually the mind dwindles, but it's not an event that strikes someone. It's something that's whittling away. It's like a war of attrition. Okay. So whenever you see the word cerebrovascular, you're really looking at a long timeline, whereas stroke is like sudden. This is happening right now. Okay. Originally, the most famous acronym for stroke is FAST. You may see facial drooping. You may see an arm weakness happening. You may see difficulty with speech. You should know that you only have a limited amount of time. You should call 911 to help. Okay? After the last few years with the pandemic, FAST has changed. So I'll call it FAST Plus. Okay. so now there are symptoms, new patterns that can happen when someone has a stroke, and it's intertwined with what happened during that. Okay, so that's what we're trying to grasp today. Okay, and we're going to go over some of these, which we point certain ways to recognize it. Okay, but because of that, to me, it's not just FAST anymore. There's some key other symptoms that you need to recognize that this could be stroke plus a heart attack, or stroke plus COVID-19, or stroke plus like just a negative effect from having too much medication or a vaccine, etc. Okay. So originally, the original stroke statistics for this. Okay. This is back in '70. I first started seeing the first, right? And what I used to tell people is that 100 years ago, the average lifespan of an American was about 52 years of age. That was the average lifespan 100 years ago. Not that long, right? I'm in my 50s, right? So that's pretty scary. But today, because of technology, because of better lifestyle and everything, the average is closer towards like 79. Okay? As a result, because people are living longer, right? And we have hip replacements, knee replacements. Like if my mother did not have 2 knee replacements, I don't know if she'd be around right now. Okay. But now she's annoying the crap out of me going everywhere and driving a car and everything. So lucky for technology and stuff. Okay. However, because we can live longer, right? When people only lived to about 52 years of age, they didn't have to worry about dementia. They didn't have to worry about slowing down, about memory loss and stuff, right? Now that we're living longer, we're seeing it more. And because we're seeing it more, flat-footed. We don't have enough housing. We don't know where to put people. And if we do have housing, it's like buying a condominium, right? So that's why, Elon Musk is trying to colonize Mars and stuff, okay? We're running out of space. The environment's changing, right? Back then, around 2013, 2017, stroke was the 5th leading cause of death in the US. By the year 2030, they were saying that we would have about 795 individuals each year, 150,000 from that. Economic in 27, average patients about 150, 140,000 out of the hospital or the system. Okay, so basically, people want to make her, and you need to find the right. China, and just okay, we're going to talk about those strokes are usually ischemic. Okay. Furthermore, sorry. Today, in 2023, okay, stroke is now the 2nd leading cause of death globally. 13.7 million people suffer from stroke. Okay. And 50% of these strokes are now between the age of 18 to 50 years old. 18. Is that unusual? That is unusual, all right? Intracerebral hemorrhaging strokes have gone up 10 to 15% annually and have increased 11% in the last 10 years. In 2022, the data showed that adults above 75 and older were having stroke at a declining rate, meaning like people that were 75 and older were getting less chance of having stroke. But the strange thing happened, okay? For adults that were 49 and younger, they started to increase, okay? Question is why? So we're going to talk about that today. Okay, so now we're seeing this trend that we didn't expect, right? The elderly, 75 and older, all right, they are getting taken care of. We rally the forces. We have applications. We have ways of taking care of them. But the younger people, they are increasing in stroke. Okay. In fact, in my office, it is sad. We do have people age 30, age 40, in their 20s who we treat who have had a stroke in the last couple of years. Okay. So this is a real thing. This is a real thing that's happening. And that's why we're talking today. I don't want anyone to turn that person away and say, I just don't know how to help you. You know, you have the tools to help them. Okay. So these are scary statistics. And when I started wanting to teach again, I was like, okay, I'm going to teach again, do a class in Miami and stuff. And I was like, oh my God, like I took a break, but stroke didn't take a break. Okay, you're going to hear that a lot today because it's scary. Yeah. Since 1990, the overall rate of people in the US surviving stroke, living with stroke, or dying from a stroke has continued to rise. So it has been rising steeply. Okay. Now let's go back to the younger people, because this is the new population. Stroke in younger people, they have disproportionate social and economic impacts. And what that means, that statement means is what we use to measure why people are having a stroke in all these studies doesn't apply to the younger people, right? They're younger, they have different responsibilities, they're exposed to different things than the adults, all right, or the elderly, okay? And so usually the standard way to gauge stroke is called SMRFs, okay? The SMRFs are your standard modifiable cardiovascular risk factors. Originally, we always looked at hypercholesterol issues, hypertension, diabetes mellitus, whether or not they're smoking, okay? The key driver for stroke was always their cardiovascular health. But a younger person, it's not that factor right now, okay? This is pretty interesting. So it basically means the younger people have different temporal trends that's going to affect them getting a stroke compared to the elder population. And this is the part today, they're still trying to figure out how to classify this, but they at least were recognizing, okay, that this is a problem and stuff, right? So basically, what we did find was that there were novel risk factors for these younger people, okay? And just to reiterate what the original risk factors were, so I love the Smurf cartoon when I was younger. The original risk factors was obesity, okay, being physically inactive, okay, having certain vices like drinking, drug addiction, right, smoking, using cocaine, methamphetamines, right. Other medical risk factors could be high blood pressure, where I said cigarette, diabetes, okay, and very commonly, I don't know who doesn't have this in their clinic, you always have patients that have obstructive chronic sleep apnea, right? So, Daniel, do you have patients that have that? Right. Yeah. Have you guys seen that in the clinic? My husband snores, can't sleep, he has to go in the living room or something like that, right? So these are all signs. When you see that, when you see any three of these, it's your job to tell this person that, okay, you know, you're at high risk of having a stroke. We want to change your lifestyle. We're going to start talking about why you shouldn't eat raw salads now, why you should have kanji, all that great stuff, why you should wear a scarf in the classroom, all that stuff, okay? So just looking at the cardiovascular system and the heart is not enough right now, all right? so this was originally how we looked at things statistically for the last 50 years, right? Now we have new environmental factors, and this is what's exposing the children, the younger people, people in their 30s, 40s, 50s, okay? And so their new factors are migraine. They're looking at the incidence of migraine headaches, the amount of air pollution or oxidative stress that we have, whether or not they caught COVID-19, a flu, a cold. Okay, so don't just limit this to COVID-19 is what that's saying. Okay, noise pollution, loud sounds, chemical pollution, pesticides. Okay, oral contraceptives definitely, which everyone knows actually induces strokes too. Okay, has that potential. Depression and taking depressive medications. Okay, all have the chance of increasing the risk factor for strokes. Okay, so these are some of the ones that I gather that are the novel environmental ones. Okay, but for the young person, it's very funny, right? What does a young person do? You can't even get the iPad away from them or get them from a video game, right? If they're really locked on it. Okay, but actually, younger people, there's an increase of atherosclerosis in younger people. Okay, they have cardioembolic strokes. It's increasing 15 to 35%. Just sitting there playing a video game in a crouched position for 4 hours, 6 hours, okay, causes lack of physical movement, increases your chances of having a stroke. Okay, migraine cases in younger people went up 20%, interesting enough. And I think it's because the amount of screen time, okay, and engaging your cranial nerves and your eyes and your brain, it's just disproportionate to when we were younger. You know, dirt fell on your hand and you kept playing. Okay, drug use has gone up. Okay, and also other just regular, more like genetic reasons, where there maybe in their blood they may have certain coagulative factors. Okay, so all these things are contributing to younger people having stroke and those environmental conditions. Okay, but does that mean only younger people are affected? No, it doesn't. Okay, unfortunately, why this is on the rise and everything, it's because the pollution, the noise, and the air and the chemicals we're exposed to has exponentially grown in the last 10 to 20 years. Okay. Okay. Anyone remember this last year? Okay, what was that? That was the GW Bridge. Okay, and that was on the day when the Canadian smoke traveled from Canada, right, to the Northeast. Okay, that's the GW Bridge. You couldn't even see the other side. Okay, now this is what's scary. When I lived in China, and I was there for quite a long time, in certain I was a madman. Okay, and I do a heavy metal test after I left every time. After I come back. Okay, and yeah, I ate sushi, and everyone eats sushi. There's a little mercury, right? But after living in China for a long period, I started getting arsenic in my blood. Okay, I started getting cadmium. I started getting lead in my blood, nervous system. Okay. Now, when I was treating patients that week, when we were having a week of yellow smog and thing, actually, I couldn't do well at all. I had indoors.
We've all lost sound, so hopefully it can get fixed.
Hi, we can't hear from the Zoom. There's no audio.
That's especially in our subway systems. I think our subway systems has been updated. So the newer subway system that I saw in Asia was actually extremely speed. So to give them credit there. Okay. When COVID-19 hit us and exposed us to its viral effect and stuff, the main thing of what to understand how COVID-19 affects stroke is COVID-19 will cause a huge amount of inflammation in the endothelial lining of your blood vessels. Okay. And that's sometimes called a cytokine storm as well. Okay. So when those vessels, right, get inflamed, the space gets smaller and smaller and smaller. Okay. And unfortunately, COVID-19 had a way of rapidly covering a lot of ground and also of skipping systems, okay, unlike other viruses, right? So that's the main thing to understand about COVID-19, right? So with COVID-19, in the last couple of years, they've done a lot of studies, huge studies, and they were seeing the effect of COVID-19 on blood clots, okay? In the studies, they were seeing that COVID-19 in older stroke patients will cause very serious, dangerous blood clots. They were also seeing that COVID-19 may increase the risk of embolism, deep vein thrombosis, embolisms in the leg, okay? Especially if the person had COVID-19 and was hospitalized, right? Because now you're not moving and you're laying there, but the inflammation keeps increasing. Okay, so that was a bad combination. So, okay, they did this really interesting study of deep vein thrombosis embolisms, where these COVID-19 patients with those embolisms were Medicare patients, there's about 235,000 Medicare patients who had COVID-19 and the deep vein embolism. Okay. And these patients were 65 and older, right? And what they found was that even though the patient survived COVID-19, 1 year later, all 235,000 patients, okay, suffered a stroke in that year. So they tracked all 235,000. Okay. So this is telling you that if you're 65 and older, you had COVID-19, okay, your chances of having a ischemic stroke is pretty high. Okay. So, and these are all Medicare patients. And the third factor was they had to have been hospitalized. So if you hit all three factors and you know this patient entered your office, then you know there's a high chance within that year you may have a stroke. We're going to take the steps to prevent this. We're going to check you. We're going to treat you. Okay. So now you have that knowledge. See, knowledge is power, right? You know to warn them. You know to prepare them. Prepare yourself too. Okay. So that showed that with that triple storm effect there, those factors, all these patients had a 64% higher risk of having a stroke in their life. Okay. And also, they also had to have the deep vein thrombosis too. Okay. All right. Okay. It's a little scary, but it's also now measurable and trackable. Okay, and that's in our advantage here. Okay. So this is another study in Nature Medicine. Okay. And they were looking at the effects of heart and cardiac disease. Okay. 1 year after having COVID-19. And they were seeing whether or not having a cardiac condition and having COVID-19, what were the risk factors that raised up after that. Okay. In this study, this was done through the VA hospitals, which is really interesting. They studied 153,760 US veterans. Okay. And these veterans, many of them were white and male. Okay. They definitely were positive for COVID-19, right? From March 2020, okay, to January 15th, 2021. Okay. And not only that, the 153,000 US veterans, they survived COVID-19 after 30 days. Okay, so those are the factors they're looking at. Okay, so they had COVID-19. Okay, they survived it after 30 days, but then they want to see what happened within that year. You see what I'm trying to say? What happened? Okay, so as they were tracking the condition that year, okay, they found that there was a 63% more likely chance that there's going to be a cardiovascular issue arising in these patients. Okay. And that 52%, there was a 52% increased risk of stroke. Okay. Among these 153,000 US veterans. So it was a very trackable, measurable thing here. Okay. So even though you had it, you still have to factor in reducing inflammation. You see what I'm trying to say? So that's what this is telling us. Yes, you had it, you survived it, okay, but we have to look at things in terms of 1 year. Okay. Now, this is an example of a patient who didn't have COVID-19, but this was about a year before COVID-19 started. Okay, and this patient had a fever. He had a rheumatic fever. Okay. The fever it spread to his heart and infected his heart. The heart spread the infection around his body. So his nervous system started to shut down. Okay. He couldn't speak. He couldn't walk properly. He couldn't stand properly. Okay. And so when we first met him, this is what he looked like. So he has to look down. He's only about 12 years old here. But when you see a younger person, and the reason I'm showing this is just to show example what to look for. Okay. When he turns, he can't hold his balance. He can't measure his step. Every step is a different step. Okay. So when you see that, you're seeing a neurological movement disorder. that's walking right in front of you. You should pay attention to it. So, okay. He couldn't focus. His body was so not functional. He couldn't even bend down to tie his shoelace. Okay. After the first session, he still couldn't control his hips. See, his hips were changing and everything. Okay, and this is because the nervous system has too much inflammation. Okay, but right, able to get his balance. He didn't get the ability of the left ear of the brain to talk yet. Okay, they come to me. They had to give steroids and some other medications, and he was good for about 30 minutes. So after that, she just brought him there every day because he screamed at everyone. He was like, Valentina's up. We have to hold him down. We're like, all right, BC6. Like, yeah, it was painful for me, right? I think Val, how sometimes like, okay, I'm coming right back. Okay, here we go again. You're gonna get better, kid. He got better, and he was even walking amazing. Then once in a while, he would have a flare up. Flare ups would look like this is worse, right? And not like couldn't stand properly, right? So a couple of weeks, we're like, what is going on here, right? And you know what it was? It would have like the worst kind of sugar that you could get, and the sugar short circuits the brain. Even though we had him going on a good keep talking, then he couldn't talk again. So sugar is a major thing, which we'll talk eventually about another time. Okay, that's the spinal hole. Now, after 15 visits, okay, this is what he looked like. All right. No herbal medicine, no Western medications. He has a little swagger. He thinks he's like model now. Very annoying. Yeah, new jacket. Okay. Yeah, very confident. Okay. And we had to tell his mom, like, you gotta hide the cereal. You gotta like lock it off. You have to get him off candy. So this is very important. This is showing that you in your clinics, you in your office, you have the ability to treat someone that had his whole short circuit of his nervous system from an infection, from fever. Not only that, and I don't have it here, but I have the test results on the chart. His heart had swollen too, but after the 15 sessions, they remeasured it, and it returned back to normal. So, pretty amazing that the body can return to it, right? But we would count like 45, 50, all those sessions, right? Like, I'm a positive person. In the first 5 years after school, I would have stopped at 20. like my friends would be like, how did you get them to come 20 times? But I believe I'm helping them, but then maybe I didn't have the right tools. But if I know I have the right tools, and I know I just have to paint the next layer to help the person, then we keep them focused. And you have to be on your best game too. You have to know that you're doing the right thing. But that's why I'm showing you stuff in this way, to show you not to stop after 4 sessions, not to stop after 8 sessions. Pay attention, get measurable things that you look at.
How long? 15 treatments over a month, over?
I think I was like that 2 months, 2.5 months. Yeah, about 3 times a week. So yeah. And I'm talking this way in a very I'm talking this way on purpose. Okay, because when I graduated school, and I gave you a great session and you were walking fine, and I'm like, damn, it's walking fine. That's right, you're walking fine, And then they would ask me, well, how often should I come in? And I'd be like, once a month. You know what I mean? Like you were just scared to say it, right? Like, which is giving you like the kind of expectation you put on yourself. Like I can fix you in one visit once a month, right? That's pretty unrealistic, Now that I've seen injuries and different nuances to injuries and different tissues that get injured and stuff, But when you know what it takes and like if it's a tendon versus a ligament versus a nerve, then oh yeah, this could take 3 months, maybe twice a week. This could take, So you have to educate yourself to know what you're treating, or you have to meet someone who fixed it, or something like that. Okay. So that was a good question, but that's why we do that, And when we have someone that sprains their ankle or hurts their knee, we may literally just tell them come in 3 days in a row, and they're done. We're done, Maybe come back once, but what's in acute like that? It's in a moldable state. If I can keep you in that state, I can fix you, and then you can go back to your sport or activity or whatever, right? So you have to know what you're looking at, right? So, but when it comes to this, right, the gold standard for neuroplasticity, right, which is a very important word, is 10 sessions. I don't care what it is. It could be hypnosis. It could be, anything that say they can treat the nerves. They say I can treat your nerves like once a week for a month. That's not enough. If you really want true neuroplasticity, 10 sessions, and then you can reevaluate it, because the nerve is a tissue that needs to be guided and treated correctly. Okay, and that's the gold standard. Whether you're a neurosurgeon, bring gold standard. Okay, right. The Chinese standard is 1,000 times on your knees. Okay, so the common symptoms, right? Tying this together because we need to move on a little, right? Oh my God. Okay, so the common symptoms of COVID, stroke, and heart attack, they now have a commonality, right? So this is important to know. Okay. In all three, you may see weakness of the arm or leg, right? In all three, the person may have difficulty speaking. In all three, the new thing is they may now have a swelling or tenderness or pain or a little discoloration, okay, around the limbs, right? And I'm going to explain this one more in detail after the slide. But in all three, they may have shortness of breath, okay? In all three, they may have chest pain or pain radiating down the arm, or radiating down the back, okay? So in all three, right, you may see these common symptoms, okay? But after COVID and after COVID was recovering, and after we started seeing all the long hauler syndrome people, right? Because they started appearing in all these cases of brain fog and just feeling like some people had ants all over their body or something like that. Okay. We started seeing a new kind of pattern. Okay. And in our office, we call this the neurological hot flash. Okay. So this type of patient had to have COVID or had COVID and just had the vaccine, okay? And they'll start seeing these symptoms 2 to 3 weeks later. They'll get really strong, all right? And they lost the taste under their skin. They may feeling a buzzing feeling in one leg, all right? They may feel chest sickness or nausea. They may not even have facial twitching, but it'll feel like their face is twitching, buzzing, okay? And very commonly, they may have these certain patterns behind the head, which we're going to teach today in the audience. These little squiggly line patterns that appear in the head, okay? They may have neuropathy in the limbs and the chest, okay? They definitely may have headache and brain fog, and also blocked sinuses, okay? When we see this combination for roughly 6 about 6 of the symptoms, we start changing gear. And we start looking at the immune system and other factors. We don't just, meaning like you can come in with 4 these symptoms and I may start acting like a neurologist, or, you know what I mean? I may start testing the nerve stuff. But when I see it as a pattern like this, I start asking questions about your history, right? Did you just get the vaccine? Did you have COVID? Did you have a flu? Are your sinuses blocked? You see what I mean? So now we put them into the right category and we have them in the right section of how we're going to take care of this patient. Okay. A lot of times with the what we coined the neurological hot flash is it can be in the front of the body around REM 17 rising up, just like a hot flash. Okay. But it doesn't feel like heat. It feels like tingling. That's the difference. Or it can be in the back around UV 17, also feels like it's tingling. Okay. And very specifically, it doesn't have to be both sides. It can be one or the other side. It's very strange. It's usually one or the other side. Okay. Neurological flashes can also be one limb. Okay. Not just both limbs. Sometimes they are both limbs. Okay. But a lot of times it's one limb that's just, this is the limb that's bothering me the most today. This is the one. Okay. If it's both limbs, I may go back to orthopedic land. Okay. I may think, okay, like whenever someone has both hands tingling, I may think, okay, it's the neck. Both feet, okay, it could be the sacrum, could be the calloquina, could be the lumbar area, right? When it's one, I start switching gear a little bit, right? Everyone kind of got that? Okay. So my recommendation is when you have patient, all right, COVID-19, right, but they came in, and this could be a patient you've been treating for 10 years. I know this patient. I don't even have to look at this patient. I can treat this patient, right? And they come in with that same hip pain. It doesn't seem to get better anymore. Doesn't seem to get better. The treatment that worked for them for 10 years doesn't seem to work anymore. You have to go into the history of their immune system right now. You have to treat the immune system as well as treat the orthopedic area. And if you don't treat both, these are very difficult cases to treat in general. Okay. So there are ways to palpate the neck, the face, the lower back, and the hip. Okay. And so what we want to do is tie in, and we're going to introduce it today, like a special kind of head diagnosis that helps you figure this out very quickly, that we figured out in our office. Okay. We won't teach you this right away. And tease you with other stuff. Okay. Just because I know this is going to come up in the Q&A, right? What's my favorite point to use if I had a stroke patient and I was visiting this patient in the hospital, right? And I'm really not really allowed to treat the patient and give them like a full treatment. Okay. The one point I would actually go to would be spleen 6, actually. Okay. Because it's very accessible. It'll be full of chi and blood and opportunities. And the reason why I would do that is because at the 45-degree angle, which is what we treat, what we teach, and the Acupuncture and the Shiu system, you're going to access the tibial nerve, a very exposed artery and vein, and a lymphatic system. Okay. And the whole method with the nanopuncture system is that there's a yin excess, which is that endothelial inflammation. It's causing a lot of yin excess, and you need to pick points that will actually disperse, okay, the yin excess and the dampness and stuff. Okay. So if I had to pick a point, all right, I would pick spleen 6. So, okay. So, and I would do that at a hospital or facility. And then run away. Okay. I have been kicked out of hospitals. So. Big nurses, you know, like, okay. So this brings us to how do we know that this person may have had COVID-19 or that the COVID-19 or the long hauler syndrome is affecting the patient too much, okay? So this is coming out of a book that I'm actually writing right now on how to diagnose certain things with the head and the skull. Okay. And this is very objective, but if you palpate the back of the head below the EOB, you slide your fingers up. And look, everyone's going like this. Like everyone at home's like, what? What? Okay. You'll start to feel these ridges and lines, like little squiggly lines. Okay. When you feel that, even though you're treating elbow pain or lower back pain or hip pain, you're going to know right away that you're having lingering effects, okay, of a flu, a cold, and especially if it's COVID-19, okay, or the coronavirus, right? So, and then what you want to ask the patient, because if you can feel this, and we're going to teach how to do it today, we're going to pair up a little bit. That'll be our fun time, okay? You'll know right away, like when we don't even see the patient, they're already lying down, we never met them, and we start palpating, we can tell right away that they already have brain fog, that their sinuses are blocked, you know. So we use this as much as pulse diagnosis, as tongue diagnosis, and it's very objective. There's no, like, it shows up as landmarks and stuff, okay? And the head and neck will change a lot, okay? So let's grab someone who wants to come up, and you can stand here or sit here or anyone. Okay, yeah, all right.
I have a chair here too, if you wanna.
Yeah,
Would that chair?
okay.
Would that chair work?
All right. And then I'll show you how to palpate it, and then yeah, so okay. Right. And then you say hello to your friend next to you. Introduce your name. Yeah, I palpate your head and stuff. Okay. So we could sit here. Yeah, facing that way. Okay. Now, if we were on the table, and then she's facing the ground here, I would be in front. Okay. And I'm going to take my 3 fingers, right? And I'm going to touch the back of the head up here, right? And then I'm going to slide down like this. Can we do this? It's a carrot. Yeah. So I find the EOB here. My 3rd finger is on or near the mastoid process. 2 fingers, next finger is just below the EOB. And my 3rd finger just rests in the middle, right? And from here, I'm going to slide down like this. Okay, and down the neck like that, right? And when I do that, what I'm going to look for are these ridges that will feel like this when you go up and down, okay? Like that. Another angle you can do this is you're facing head on this way, okay? And you take your fingers, I'm just going to do it over your hair, okay? And you start pushing back and down this way. You follow it again back towards GB20, okay? Like that. Okay. Yeah, it is kind of like a head massage. So, okay. Whatever I'm feeling on this side here, tell me about the left side. And this side here is comfortable. But I can still have a little. Okay, so come down here like this. We're gonna practice this because we're here and I can adjust how you're doing, then you could try it at your office, right? So. The cool thing is, even if it's like when you have autoimmune issues, there's a way to treat them now. Massage on my neck. Because I also, I'm allergic to meat and sugar. Not supposed to have sugar either. Yeah, like red meat. Red meat specifically. Yeah. Are you alpha gal? Or are you? It's genetic from my father's side, so which okay. Well, get cheated. I know if I accidentally didn't I yeah. The level of information and stuff. Okay. I don't, but then when I do mistake, I'm like, oh, I see a correlation. Yeah. You keep treating the neck. You're on you're on the right track there. So, yeah. So around C7, okay, C17 that's where we usually look at to see and to judge the severity of autoimmune disorders and stuff. And then there's ways to treat that area, which is kind of funny, even in chiropractic. The C7T1 is a very important vertebra, you know. So, but this is what Chinese and also about neurology. Like they both to me explain the other side. Like because I don't look for disproving anything. I always look for like correlations. Okay. And it's not like I wanted to find that. It's just that like if you're palpating heads and you're looking at necks for like, 30 years or whatever, so you start to see a pattern, And so what I'm trying to do is that'll accelerate which behind it. It's not like my approach has never been like, oh, I found that bump or something. And then I get the biggest needle and I pop it, it's not like popping a zit or something. Like stick to your principles of TCM or whatever your method is, or Moxa and stuff like that. Okay, and you can treat it. Like this can actually block. So yeah. Cool, thank you. So,
Sorry, would you be able to just show the palpation again, just because sorry.
yeah,
Yeah.
Okay, so we'll do here. We'll do the side. And we're gonna go straight across above the apex of the ear. And then it's gonna go down towards GB20 and pushing towards UB10. Okay, so, and then from this side, sorry. Okay, I'm gonna find the EOB right here, put my 3 fingers here, and I'm gonna palpate down, okay, like this. So I've done workshops and seminars, and we'll have a guest, right? And then we're just talking about the second we talk about it, like when you learn to recognize this, you find it very quickly, And then if you do find this pattern under your fingers, okay, then you'll know right away that sinuses are blocked. Maybe they lost some smell, et cetera, et cetera. Okay. So that's the main takeaway from today with this slide and stuff. So, okay, thank you. So you guys want to, I don't know if we, you guys want to pair up for a second and just check your partner. Yeah, that's good. Okay. I saw Tom. Oh no, that's right. Valentina Duque is in the back. Dr. Duque, she is my colleague. If she helps Daniel, she can come and help. There are a couple of thumbs here. There. Oh, there you go. One more.
There it starts.
Okay.
Have you had COVID? That's mine. I had it 4 times.
Does it feel like it's live with you?
Yes, there's like.
Very subtle. You had it 4 times?
I've had it 4 times. I've had it
You had it 5?
but I had it once ago.
Okay.
And I lost it now.
You lost it all the first time?
This time, the first time I did it.
You know, it's
And
like- we have to fix it. Nice one. Okay. So we'll see. So we're here. Here's the ear. You wanna slide down. Yeah. So this will feel close to the center. How you doing? You feel-
When was the last time you had COVID?
Yeah.
But I definitely have, like, there's long, there's, I mean, I do not have time. But I have.
Well, you might not get enough. Yeah. Okay. Okay. What- yeah.
You're like, what? I mean, I have it all.
Yeah. It'll feel like bridges on it. Yeah, it's a little bit. Did you have that?
I guess so.
Yeah, I feel like you have some issues too.
Very short-sighted.
Show me on
You can talk about it.
I have questions about it.
It's not on her. Let me check. Or you check her first. Yeah.
Do you feel my ridges?
Yeah.
She-
They were pretty
Miss
prominent.
Yin Yang has. Miss Yin Yang
The
has it.
worst,
Like,
great. I don't want to win that prize.
uh-huh.
like, you know what?
Yeah. She's okay.
Yeah.
Now,
You're the best.
how did that?
Do you want to touch
How
mine?
did you know that she had a fire? Like, where did you feel that?
Oh, I felt it on the, like if GB20 is here, I felt it on the outside, like a little ball.
Yeah, my left eye is worse than the
Yeah.
right eye, yeah.
What were you saying about?
The alpha gal?
Yeah.
So that's a type of tick.
Oh, I have it. I don't.
You have it?
Yeah,
Yeah.
I was curious that you were.
So, because she said she couldn't eat red, or she couldn't eat meat, so I was wondering if she had Lyme or something like that. So, but you had Lyme a little. Did you ever have Lyme?
I've never had mine.
Yeah. Did you have alpha?
Yeah. And I've had it for 5 years.
Oh, really?
Yeah, and it keeps like, the levels just keep going up and down.
Oh, really?
A whole lot of, yeah.
Yeah, there's ways to treat it, to get it. So it's a little more stable and stuff.
Yeah.
So, and there's some herbal farming. Yeah. It doesn't 100% work, but it keeps it on the.
Do you wanna feel?
Yeah.
Yeah, I have.
Yeah, yeah. Yeah. What have you guys found so far? Yeah.
Yeah.
That's okay. Sometimes when you find nothing, it's a good sign. Like,
You don't have to.
a little bit.
Oh, yeah. It's like, there's other, there's like, oh, yeah.
Like, it feels like a muscle.
Ours. I mean, don't say yes. because I said that.
And then look at just little signs. And then the.
Yeah, like it's sorry.
She did it harder. He did it
That looks like
like
that.
about your.
You don't have to find a bunch of things.
No, but sometimes it's that. Actually, it literally looks like that, which is. Do you get allergies or how good is it?
Maybe,
Uh,
maybe some
Yeah.
allergies.
So if you feel here, this is bladder nose.
Mine.
You feel this a little more.
When I took
So this one correlates things up. She said this. Is fine.
Is it a
Oh. Feel a little bit, not super big. Yeah, you're gonna make it.
So Clayton, we actually have a,
Yeah.
oh, sorry, I just have a question from the chat over here. How do you know it is just the bone structure of the skull versus the ridges?
Yeah, because we're not palpating deep enough or hard enough to feel that texture of the bone. So it's a good question. So we don't push so hard that we're even massaging. It's a very light touch, right? If I came around to, okay, so it's a good question.
Oh, and also, sorry, just one more question is, will the symptoms be ipsilateral, like regular scalp acupuncture treatment?
No, it has nothing to do with scalp acupuncture, but this is more for a diagnostic tool. And then there's other ways to open up the gallbladder channel to fix it. So, but you would be doing that on the affected side too. So.
Okay, so it is, so you'll feel it on the same side. It's not, you won't feel it. It's a lateral.
Not necessarily, but it depends how the body is presenting it. So,
Okay,
like,
thank you.
yeah, no problem. So, Daniel, you got. You're good? She hurt yours? Really good. Oh. Oh, yeah. Okay, anyone have a question? That is a good question. So we'll answer that one first. Okay. Yeah.
Jaw on that, but she has a problem with jaw and her eyes.
It's yeah, there we go.
I just have to do the like, it's so full.
We know now. Yeah, right.
Yeah, this is a good spot. We can see.
Yeah.
Exactly.
How's your left eye? Did you ever have a concussion? Okay, once in a while. So when we go from the back, right, here's the EOB. Yeah, starting there. And then as we palpate here, right, you did it correctly. I didn't explain it that way, but you don't just go straight down this way. You go down and you start converging more. So that my two index fingers may drop under each other. Okay. Did you ever mox do 20? Yeah. So for you, like doing the mox on default 2d20, it's good for your circulation. You know. Yeah. Is it okay if we go past?
Yeah, oh, yes, I'm totally okay with it,
Okay.
as long as it's okay
You
with
guys-
you,
you guys
yeah,
are-
and everybody else.
Does anyone have to check a parking meter? Am I good? Am I gonna-
I do have one more question from the chat is, so will the ridges be vertical or more diagonal toward UB10?
It can appear both. Excuse me. But like it also the picture looks symmetrical, but it can also be tangled up looking. It doesn't have to be so symmetrical too. So, yeah,
Thank you.
a good question. You write my book. Okay, that was interesting, right? So we got a little that kind of palpation is very good, not just for COVID-19 and sinus palpation, but it's actually good for analyzing like head injury, traumatic brain injury, and stuff like that too. Okay, so this is good. Everyone did a really good job feeling it and stuff. Did I get to everyone? Or you guys are good too? Okay, good. Okay. Just to keep everyone inspired and stuff, and it still amazes me. This was a patient of ours, and we talked about the gold standard of treating someone at least 10 times. Okay, he was in a train accident. His car got hit by a train. Not sure why. Okay, it had broken his neck. This was over 20 years ago. Okay, so when I first met him, that was day one. Okay, and he barely had shoulder muscles. You could see his clavicle and his scapula from the front of his body when you're standing in front of him. Okay, after the 7th session, his neck started to grow, to thicken. Okay, his shoulder started to get more muscular. After 15 sessions, his shoulder was almost fully developed. He had the strength to lift his head again. Okay, and this is from an accident over 20 years ago. And then after that, having several strokes, even cancer, heart conditions, you name it, he had it. Okay, but with our method and trying to stimulate the blood flow correctly to the brain and to the spinal cord, and to promote healthy cerebral blood flow, you could see the neuroplasticity effect. So this is showing you that acupuncture is capable 100% of neuroplasticity. Okay, so yeah, pretty amazing. And he was very funny. He was like, "Why didn't they show me this 20 years ago and they needle this way?" You know, and my answer to him was like, "It hasn't hit the shores yet." Yeah, so that was the mission. Okay, so winding some stuff back to give you guys more tools. When we see the word cytokine storm, we're always referring to the endotheliitis that happens with COVID, blood vessels. Okay. During COVID, at that time, a lot of ingredients in this store were sold out. In fact, Kamwo had to close, right, for a short period of time because they couldn't provide any more herbs. They were not be able to get herbs. We weren't able to sell more herbs, right? So that wasn't the store closed for almost like
prescriptions that are sent to East, but no one posted something else.
Yeah, they wouldn't even let me get herbs.
Right.
Yeah, for sure. Okay.
Yeah, someone,
So-
that's someone like crying outside the door, but you let them in.
yeah, I mean I mean, honestly, if someone was dying or exposed, and I'm not surprised. I'm not surprised that happened more, you know.
Right.
So yeah. So a very simple bottle like licorice, okay, or bansha or whatever. Maybe it was like could be bought for like $8 or something, right? All of a sudden it's selling for $80 because it could treat phlegm. It could treat phlegm in the lungs, okay? And at that time, I was even calling friends in Chicago or Colorado because Coloradian acupuncturists were noticing more of a dry, humid cough because of the elevation, whereas we were getting damp heat, right? Exposure in the Northeast. So they didn't need certain herbs, and we would trade like that, you know. So you have to have your network of friends who you graduate with. They may or may not be the best friends of your life. Okay, so that was the network back then. All right, and just to give you this, we compiled that these herbs, okay, had sold out the most, but more importantly, they were able to downgrade inflammation, okay, during COVID, during the coronavirus, during the pandemic, right? And the reason why was they were able to block and downgrade certain interleukin cells, okay, and receptors, particularly Huang Bai, the three yellows, right? Japanese honeysuckle flower, Jinyanhua, Lian Chao. Even interesting enough, the clear heat drain fire category like Shurgao, Juramu, amazing. Like at that time, I became, for the second time in my life, a born again herbalist, and we were like Amazon herbal delivery for all the patients that I had and stuff. And I'm not kidding, right? Like it was like the FedEx centers were selling out of envelopes and boxes because people were shipping stuff constantly, to the point where we would have to drive to certain FedEx places and just stack them up because we couldn't ship herbs and we couldn't get the package so that it could be dropped off. Okay, so these are definitely scary times. Okay, but certain herbs I used a lot were like definitely like Jurmu, Huang Chen, Huang Lian. And the reason why is because the last four herbs, even though they clear heat and drain fire and fever and inflammation, they're actually very nourishing. They didn't completely dry out the body. They made the body moisten as well, okay? Which was a little uncharacteristic for being so powerful. So it wasn't just, we're not just get rid of the evil, get rid of the pathogen. We always, in Chinese medicine, we always try to nourish the body at the same time, okay? So typical formula combinations, in our office, we keep it simple, right? KISS, KISS, all right? So, but one of our favorite formulas, which we love, and our senior herbalist guided us in our group, was Chai Hu Guizhong. Amazing combination, has a lot of the previous herbs that are listed here in it. And if it's not listed, you just added it, okay? But it had Chai Hu, it had Guizhong, it had Huang Chen, okay? And adding the Chai Hu is really important because the Chai Hu will smooth out the tension, right? And the chi constraints, but also, it's also like this, like in my opinion, and I'm just saying this literally on the spot, like the way COVID could jump and move around very quickly, the liver chi can do that too, right? When it's upset, So an herb like Chai Hu, right, was arming the liver to help smooth out things. So maybe you can memorize it that way. Okay. We also used a couple of formulas like Gagantong when it became too much of a cold bee situation. Okay. And then just for some simple modifications, we'll use Renshen and Dazao to treat phlegm, chest congestion, Fansha, Gualu, obviously for dry phlegm, Xingren, crave it for shortness of breath. I definitely always, for coughing, use a combination of Wu Weizi, Shishin, and either Shenjiang or Ganjiang. Okay. And definitely in your apothecary, keep Gualu P. Okay. For all the different types of phlegm. One thing that we love to do in our office, even though we are strict translators of the Ling Shiu, we like to expose ourselves to modern technology. Okay, so we actually have this machine. It looks like a tanning booth. Okay, this is called the Region Pot, and what it does is it treats the immune system and treats fatigue because it will oxidize and increase ATP in the mitochondria. Okay, it takes the red light wavelength. Okay, and these are the different wavelengths with invisible light. Okay, it takes the range between 600 to about 750. Right, and what the red light does is through this process, through the skin, because red light will actually go through past the skin into your muscles and nerves. How do I know that? Somebody give me their cell phone or anybody. Doesn't matter. Okay. Okay. This is every color in the spectrum. Okay. But if I cover it with my finger, what color is my finger? Right, because only red wavelength passes through flesh. That cool? That's so cool, right? You're sitting by the campfire, you're making faces. You do this, everything's red. Okay. Red light and that wavelength. Whoop, I turned on the picture. Covers, passes through your flesh. If it has enough battery power, it'll make it to the tendon, connective tissue, it'll make it to the nerves. And if it makes it to the nerve, and nerves has their own neurovascular circulation, it's going to increase ATP in the mitochondria of those tissues and give you energy. Okay. They did studies looking at the elderly. Okay. And in this diagram, what happens is in the elderly, our cognition tends to break down. Okay. The cells further break down. There's mitochondriophagy, which means the mitochondria starts to get eaten up as we age, okay, in the cells. And they did studies showing that the red light therapy started to protect the mitochondria from breaking down and started to increase cognition, basically. This was a study that was published in the Journal of Neurochemistry, right? Yeah, not acupuncture today, okay? Okay. Because of that, we use different devices. We do anything. We do anything that's going to help, that's going to work. Okay. This is really cool. So when you're exposed to COVID and when you want to know and you want to test for COVID, what do? They always put the Q-tip up the nose, right? Because COVID enters through there. And a lot of the bodies of the virus are still in there. Okay? So usually this company is called V-Light, which I use a lot, and I'm getting nothing from them. Trust me, I tried. Okay, but like they always had a red light device. When it was in the 600 range, it actually stays in the frontal cortex, frontal area, and it actually was good for the immune system. When they have a red wavelength that's in the 850 range, it can go through bone tissue and help with things like the basal ganglia, thalamus, other deeper brain centers. Okay. After COVID, they made a special blue light. Okay. And the blue, it's interesting because the blue light they found in a study helped to actually treat microbial exposure. Okay. So this is what the devices look like. And for some of our patients who have like the nasal congestion, who definitely have brain fog, who definitely have blockage in their sinuses, we know they have COVID. So sometimes we have them get this device. Okay. There you go. Okay, so I don't know if you can see it. I'm not putting this on my nose, but it would just go in here like this. It's on a timer. And sometimes we'll do this during the treatment. We'll put this in. Okay. We'll do LI20, we'll do LI4, we'll do sessions like that. Okay. So this is the red one. The blue light is actually, it's blue because it's in the 470 range, right? So if I look at this, I'm in this range, right? So now I'm in the blue range. So the blue range will actually, they promote it as like the COVID wavelength, basically. They want the microbial stuff. Okay. So what I like to do is if someone had a stroke, I would go towards the red wavelengths. Okay. With the blue, okay. Wintertime, blue. Okay. So you put this in here, and so the microbes are in the needle patches that get exposed to the light, and so they are killed actually. Okay. So the neat thing is when we lay in the region pod, you can lay in there, and even like your sciatic nerve, and we have different athletes, they feel great after that. So they get exposed to that, and they get like faster muscle recovery and more energy and stuff. Okay. So this is just fun things that I like to show, mainly because I think like it's great to incorporate that into your office or into your practice and stuff. And seeing how they do the studies and stuff, you start to learn the neurochemistry of things and the neural exposure and stuff. Okay. So that's a company that we like to use their stuff. It seems pretty dependable. The reason why, and I may have some lecture where I'll just talk about the product work because there's so many ones out there, like ones that people do even for estheticians and stuff. And if the accuracy of the machine isn't right, it's not going to do anything, right? But when you go to the OR room in the hospital before they do the surgery, they shine an ultraviolet light for about 2 seconds and then they start the surgery. Okay. Or when the dentist does dental work, they'll step up, they'll flash at the dentist. So there is something to it. You just have to make sure that you're picking up a product that has the frequency they're claiming to have and results and stuff like that. Okay. So we may if someone can't speak, we may use like a gamma wave setting. And the gamma wave will actually start increasing their ability to talk. It was like speech aphasia. That's really neat. Okay. So just want to we always like to throw a little technology into the lectures, figure out like, we'll be like laser first, then needle first, or something. So, okay. So, so that's my whole lecture. I'd like to show you this. This is our new website. It literally got done the first week of January, me returning back. Okay. It's called nanopunctureseminars.com. And so every couple of months, we're doing weekend workshops, thinking specific topics. We're going to do one in Miami for gait training to analyze walking. The great thing is after we take one of our modules, we have a directory. So anywhere in the country, and the directory is hooked through Google Maps too. If the person types in the zip code or the town, if you took one of our classes, you'll get like a badge and it shows that, oh, they did speech paralysis, this person can't talk. So it's a way of getting the patients to the right stroke trained acupuncturists and stuff too. Okay, so that's part of our whole thing. And then if you really like this lecture, March 16th to 17th at Peaches, we're going to be giving the foundation module. And so what I like to do is I like to teach the basics of needling, how to hold the needle, how to properly stimulate it, and the different techniques I learned in Tianjin. And so you get this toolbox of how to treat stroke that can work in your office or your practice. And that it's about 2 straight days. It's a lot of needle time and a lot of talking about where acupuncture fits into which stroke scenario, different spasticities and stuff. Okay, so
What is the difference between acupuncture and non-acupuncture? What does it mean really non-acupuncture?
So nanopuncture is the name of the system. Yeah, so it's just it's a name for the system that I teach. That's all. So
Okay.
yeah. It was a lot easier than teaching Shinao Kaicho. Like that's yeah. And plus, like, there's a lot of things that I do a little bit differently because we're in a small clinic setting versus a hospital. And so I bring in the other stuff like the technology and other things at work that I didn't learn in Tianjin, but we use in our offices. So we start integrating like, okay, this is where you fit in this is where you fit. And maybe you might have to fit in speech therapy, And so we teach you enough terminology to know how to talk to a speech therapist, right? Because you can't just be like, okay, here's my patient, they can't talk, okay, just let me know how it goes, Like you need to form a relationship with the different professionals and stuff until they start referring people to you, and stuff as well. So we get like we get a lot of referrals from the HSS concussion department, Mount Sinai, like different hospitals refer to our office, actually from all over. So, and then, you want to know what you do, you can stay in your lane, but you can be part of the healthcare team, right? And every patient that has suffering from what we've talked about today, they are looking to form their healthcare team. And if you're if you're knowledgeable enough and effective enough and can get reproducible results, you're going to be very busy and stuff. Okay. So yeah, so it was really fun meeting everyone, seeing that everyone has eye issues and stuff like that. Okay. But yeah, so we have a little bit of time for Q&A still. So
Explain what forms the ridges, going back to the topic.
yeah, so what forms the different ridges, I personally, from my experience, have seen, it's actually the health of the meridians and nervous system through the scalp. So you can, through following even channel theory and also what organ this area is related to, and also then looking at the brain, you can get a lot of very useful diagnosis from that. So yeah, so when we treat it, we don't just treat it by saying, oh, I'm gonna massage it out, or I'm gonna rub it out, or I'm gonna, like salt and pepper this thing or whatever. Like, we actually literally look for the right points along the meridian that start to change the shapes too. Okay, including, and then what we analyze and diagnose, it actually even fits the herbal formula, the herbal part of it too. So that's why we use it in a very TCM way. And we use that to guide us to understand what's going on too. Okay, so that's a good question. So, any other questions?
I have one more question in the chat is, are the treatments effective in ALS cases?
Yes. So ALS, Lou Gehrig's disease, very difficult condition to treat. I would say it's more effective in the early to middle stages. In the later stages, it gets much more difficult. Sorry. Yeah, much dust from the fingers. Okay, so we do have a few ALS patients, and we've had some pretty good successes with it. But I can't say that we've actually cured an ALS patient. I can say that for some ALS patients that were very, very emaciated, that after they would start our treatments, after a couple of months, they would start to gain weight again, and they were breathing better. So there's a way to treat the diaphragm that we do to help the ALS condition. So that's a good question. But a lot of it's still using central nervous system, blood flow, trying to make the nerves healthy and stuff. So yeah. Great. Okay, nice to meet everyone. Hope you guys enjoyed it.
Thank you. Great seminar.
Welcome.
Thank you, everybody.